completion of coagulation. After you activate all the clotting factors, at the very end, you're going to have thrombin. And thrombin will activate fibrin, and with that, we're going to end coagulation. Intrinsic and extrinsic factor, one thing that you should be aware of is that they need calcium in order to make it work. So as you can see here, calcium is very important on that. All these coagulating factors are going to create this process of coagulation. And at the very end is just to create thrombin, and thrombin eventually is going to create fibrin. How long does it take in order to coagulate? Minutes approximately. So as you can see here, for example, bleeding of a fingertip, then it should stop in 2-3 minutes. Let's take a look in here at the clotting factors. So as you can see, you have the number of the clotting factor, the name of the clotting factor, and where they come from. So as you can see here, most of them come from the liver, but at the bottom, you're going to see the other clotting factors. They come actually from platelets. You don't need to know this activates this one activates this other one activates this other one. So what happens with the blood clot? Once you create a blood clot and it's strong and it stops us from bleeding, then the area of the blood vessel that was damaged needs to get repaired. For that reason, the platelets as well as the cells in your blood vessels are going to release something called platelet-derived growth factor. Why? Because they will stimulate the fibroblasts as well as the smooth muscle cells in your blood vessels to multiply and repair the damage that happened in the blood vessel. Eventually, you are going to repair the area that was damaged. So once that happens, you have to get rid of the blood clot. The destruction of the blood clot is called fibrinolysis. As you can see here, fibrinolysis. So how do you destroy the blood clot? In order to destroy the blood clot by this process, you need to know two steps: kallikrein and plasmin. So if we look at the steps of destroying the blood clot, then you can hear the sequence of events. But right here, you have kallikrein, and kallikrein eventually is going to create plasmin, and plasmin is the one that is going to destroy the blood clot. So then here says prevention of inappropriate clotting. After coagulation starts to make the blood clot very hard, how come this does not continue? How come you don't create a bigger and bigger and bigger blood clot? There's quite a few factors. Platelet repulsion. Obviously, the first step is to create a platelet plug. In order for you to create a platelet plug, the platelet must be attached to the damaged blood vessel. However, the blood vessel is very smooth, making for the platelet very hard to attach to it. In addition to that, the blood vessel is going to release prostacyclin. Prostacyclin is a substance that is produced by the blood vessel that avoids the platelet to be attached to the blood vessel. Dilution. If we talk about the intrinsic mechanism, that means that you can create thrombin because you don't need the blood vessel to get damaged. So in normal circumstances in your body, certain amount of thrombin gets produced. But we have so much blood and the blood flows so fast that it doesn't allow the thrombin to actually create very big blood clots. Anticoagulants. Thrombin is the one that is going to initiate the formation of fibrin. However, we have anticoagulants. There's one anticoagulant called antithrombin that is produced by the liver. Obviously, antithrombin will stop the production of fibrin, therefore fibrin will not be able to produce a blood clot. You also have heparin. Heparin is produced and released by the basophils. Heparin is also another anticoagulant. So these three are the mechanisms that we are going to use in order to stop blood clotting when it's not supposed to happen. And then after that, we have clotting disorders. There's multiple different kinds of clotting disorders, such as hemophilia, for example. Also, the liver produces many coagulating factors. So any disease affecting the liver will affect the coagulating factors. Many clotting factors need vitamin K in order to be created. And vitamin K need bile from the gallbladder in order to get absorbed.